Welcome to the Deep Dive.
Great to be here.
Today we're tackling a really complex and, well, crucial topic, the world of COVID-19 vaccine misinformation and the hesitancy it fueled. We've gathered a wide range of sources, and our goal, really, is to pull out the most important insights for you.
Yeah, sort of cut through the noise.
Exactly.
Yeah.
Think of this as your shortcut to understanding the different types of claims that circulated and, why so many people had reservations about getting vaccinated.
And our material, it covers quite a landscape. We're looking at specific bits of misinformation about the vaccines themselves,
Right.
the political climates that sort of fed into hesitancy,
Uh-huh.
and even the various global efforts to try and boost vaccination rates.
It paints a fascinating, if sometimes troubling picture.
Definitely troubling at times.
Okay, so let's dive right in. The different forms this misinformation took. It wasn't just one simple thing, was it?
Not at all. A whole spectrum.
Early on, even before vaccines were, a reality, there was significant doubt about the pandemic itself.
Right, that foundational skepticism.
Take Tanzania, for instance.
Yeah.
The late president's stance. Basically declaring the country COVID-free, promoting alternative treatments.
That definitely set a tone of skepticism that, likely influenced later vaccine attitudes.
That's a key point, how that early denialism sort of paved the way for later vaccine resistance.
And as the virus evolved, new variants popped up. The misinformation just adapted right along with it.
Like the idea that vaccines caused the Delta variant.
Exactly. That false claim gained traction, which is biologically impossible. Of course, vaccines can't replicate the virus like that.
Right.
And then there was a French virologist promoting that debunked theory of antibody-dependent enhancement, ADE.
ADE. That sounds serious. What was the claim there?
The idea was that the vaccines were somehow making variants more dangerous. ADE is a real phenomenon with some other viruses, where antibodies, instead of protecting, can actually help a subsequent infection. It was a theoretical concern with COVID-19 vaccines during development, but crucially, it hasn't been observed. Not in human trials, not in widespread use.
It's interesting how these claims often just flipped reality on its head.
Completely. Vaccines are designed to prevent severe illness and actually help limit the emergence of more dangerous variants by reducing spread.
And it wasn't just these big, sweeping, scientific-sounding claims. We also saw official statements get twisted, didn't we?
Oh, absolutely. Like the ones around CDC Director Walensky's comments on viral load.
What happened there?
Well, what's fascinating is how easily a nuanced public health message can be, weaponized. Director Walensky actually stated that both vaccinated and unvaccinated people could carry similar viral loads with the Delta variant.
Okay.
But this got completely distorted. Twisted to suggest vaccinated people had higher viral loads and were the main spreaders.
Wow, so they just ignored the main point.
Completely missed her point that vaccines still massively reduce severe disease and hospitalization. It just highlights the challenge, communicating complex science in a soundbite world.
Absolutely. It's like taking a single brushstroke from a painting and claiming you understand the whole artwork.
Good analogy.
And this misinformation, it wasn't just abstract ideas floating around. It fueled actual criminal activity too, right?
Tragically, yes. The reports of fake COVID-19 vaccines administered in India.
Fake vaccine.
People given saline solution instead of the real Oxford AstraZeneca vaccine. It shows a shocking level of exploitation.
That's awful.
These weren't just harmless lies. Criminals were directly profiting from people's basic desire for protection.
It's chilling. And then you had the whole issue with fake vaccination cards spreading everywhere.
Yes. Interpol even issued a global alert. Organized crime rings were involved.
Organized crime.
In both the physical and online trade of these forgeries. And if you connect this to the bigger picture, the demand for these fake documents really underscores the impact of vaccine mandates in some places.
I see.
The misinformation fueled resistance, and then the mandates created this black market to get around the rules. It's like a feedback loop.
Driven by distrust and disinformation.
Exactly.
Okay, let's maybe shift focus now to the more medical misinformation, because this is where a lot of the core anxieties seem to take root.
A really persistent claim was that the vaccines simply weren't effective.
Right. We heard that a lot. How did that argument work?
Well, this is where understanding statistics gets really crucial.
Okay.
The fact that, yes, a significant percentage of people hospitalized or who died from COVID-19 were vaccinated doesn't automatically prove the vaccines don't work.
Why not? That sounds counterintuitive.
You have to consider the base rate the huge proportion of the population that did get vaccinated.
Right, okay.
And there's something called the Ewell-Simpson effect. Basically, in a highly vaccinated population, even with a very effective vaccine, you'll still see vaccinated people among the sick and deceased.
Just because there are so many more of them overall.
Precisely. Think of it like seatbelts. If 95% of people wear seatbelts, a large proportion of people injured in car accidents will still be wearing seatbelts. It doesn't mean seatbelts don't work.
That analogy really helps clarify that. And we saw this dynamic play out in predictions, like that UK SPIM report from early 2021.
Yes, exactly. They anticipated a high number of hospitalizations and deaths among vaccinated people precisely because vaccine uptake was projected to be so high.
Not because the vaccines were failing.
Not because they were failing their main job, preventing severe outcomes.
And of course, the evidence for booster shots has been pretty compelling, hasn't it? Despite the noise.
Absolutely. Numerous studies show boosters significantly enhance protection against infection and serious illness.
So claims to the contrary.
Like those made by Ron DeSantis, suggesting boosters actually increase the risk of infection. Those have been thoroughly debunked by looking at the actual data.
Okay. Another major source of misinformation seemed to center around the mRNA vaccines themselves. These widespread false claims that they weren't actually vaccines at all.
Yeah, that often stemmed from just a basic misunderstanding of what a vaccine is.
Also,
Some argued that because mRNA vaccines didn't offer, 100% protection against any infection, they didn't qualify.
but that's not the definition.
No. The scientific and regulatory definition used by the CDC, the FDA, is that a vaccine is a product that stimulates the immune system to develop immunity to a specific infectious agent. mRNA vaccines clearly do that.
And then the really pervasive myth.
Yeah.
The one that mRNA could somehow alter our DNA, that caused a huge amount of concern.
A massive amount. And what's biologically impossible about this claim
Yeah.
is that mRNA operates out in the cell's cytoplasm. It's outside the nucleus where our DNA is kept safe. And it simply lacks the necessary chemical machinery to integrate itself into our DNA. It can't do it.
So it's like a temporary message.
Think of it like a temporary instruction manual. Delivered to the construction workers, the ribosomes outside the main blueprint room, the nucleus. Once the job's done, the manual is just discarded, broken down.
That Wisconsin pharmacist who intentionally spoiled vaccine doses, he cited this very fear, didn't he?
He did. It really shows how potent this particular piece of misinformation was.
Then there was that whole debate about whether mRNA vaccines should be classified as gene therapy.
Right. This was largely a matter of definition, semantics, really, and often used deliberately to sort of conflate mRNA vaccines with the idea of permanent DNA alteration.
So it wasn't technically accurate.
Well, some academics argued that introducing genetic material could technically fall under a very broad definition of gene therapy. But the key difference is the temporary nature and the specific mechanism of mRNA vaccines. They're fundamentally different from traditional gene therapies aiming to permanently modify genes.
Got it. Reproductive health. Another major target for misinformation. These baseless claims linking vaccines to infertility in women.
Oh, absolutely. A prime example was that petition submitted to the European Medicines Agency by Wodarg and Yaden.
What was their claim?
Their theory, which had zero scientific basis, suggested that vaccines targeted a protein called syncytin-1, which is essential for placenta formation. They claimed the vaccine would make women infertile by attacking this protein.
And that was wrong.
Completely wrong. Scientists clearly demonstrated that the spike protein targeted by the vaccines and this syncytin-1 protein are structurally very, very different. The immune response to one wouldn't affect the other.
But the fear spread anyway.
It spread rapidly online, understandably caused huge anxiety, reflected in things like increased Google searches for infertility after the vaccine rollout.
We also saw those really alarming claims about vaccinated individuals shedding spike proteins.
Yeah.
And somehow causing menstrual irregularities or even miscarriages in unvaccinated people nearby. That seemed wild.
It was completely unfounded. But the fact that institutions like the Centner Academy in Miami cited this fear as a reason not to employ vaccinated teachers,
Wow.
it shows the real-world impact. Businesses even reportedly refused service to vaccinated people based on this false premise.
And medical experts were clear this couldn't happen.
Absolutely. People like Dr. Jen Gunter were very clear. The approved COVID-19 vaccines simply cannot affect unvaccinated individuals in this way. It's not how they work.
The sheer number of other diseases falsely linked to the COVID-19 vaccines is quite disturbing when you list them out.
It really is.
Let's touch on a few more. Bell's palsy, for instance. That was an early concern, wasn't it?
It was, while a slightly higher number of Bell's palsy cases was observed in the vaccine trial groups compared to placebo.
Okay.
The FDA concluded that the frequency was actually consistent with the expected background rate in the general population.
So maybe not linked.
The debate about a potential link continues, maybe a very slight increased risk. But if there is one, experts agree it's extremely rare and typically temporary, similar to what's sometimes seen with other vaccines, actually.
Okay. What about blood clots? That was another major worry for many people.
Huge worry. And unfounded claims of widespread blood clots following mRNA vaccination were prevalent online.
But there was a link with some vaccines.
Yes, the reality is that a specific rare type of blood clot was linked to the AstraZeneca and Johnson & Johnson vaccines, the viral vector ones.
Ah, not the mRNA ones.
Correct. And even with those, the risk was significantly lower than the risk of developing blood clots from getting COVID-19 itself. That context is crucial.
Right. And the misinformation suggesting vaccines could cause cancer. Where did that come from?
These claims often twisted a 2018 study that had absolutely nothing to do with mRNA vaccines.
Nothing.
No. The mRNA used in the vaccines is synthetically produced, it's temporary, and it doesn't carry the risk of the kind of genetic errors discussed in that completely unrelated research.
Okay. The scare around prion disease. That sounds particularly alarming. Mad cow-type diseases.
Yeah, that one originated with a paper published in what's known as a predatory journal.
Predatory journal.
These are publications with, let's say, questionable or even non-existent peer review processes. Their claims are highly unreliable from the get-go.
So the paper itself was flawed.
Deeply flawed. Its central assertion lacked any credible scientific evidence, widely refuted by experts, and importantly, the mRNA in vaccines is broken down by the body very quickly. It doesn't hang around, certainly doesn't persist in the brain.
Making the claim biologically implausible.
Exactly. Even the Alzheimer's Association issued a statement confirming the safety of COVID vaccines for people with dementia.
It's almost as if no fear was off limits. Even the polio vaccine got dragged into it. In Cameroon.
Yes, that baseless claim that polio vaccines somehow contained the COVID-19 virus, it just shows how conspiracy theories can jump between different public health issues, potentially undermining efforts against other diseases too.
And antibody-dependent enhancement, ADE, you mentioned it earlier, sounds frightening.
It does, and as we touched on, it is a real phenomenon seen with some viruses and lab settings or animal studies where antibodies could theoretically worsen an infection later on.
But not with these vaccines.
Right. While it was a definite concern during development, something researchers watched very closely. Extensive human trials and now billions of doses administered worldwide have shown no evidence of ADE actually occurring with COVID-19 vaccines.
Okay. Then the false claim about vaccines containing aborted fetal tissue. That caused significant ethical concerns for some people.
It did. And it's important to be precise here. Cell lines that were originally derived from aborted fetuses decades ago were used in the development or testing of some vaccines, including Oxford AstraZeneca.
But not in the vaccine.
Correct. No actual fetal tissue is present in the final vaccine product. The components are purified, separated from any cell material long before they end up in the vial.
That's a critical distinction often lost. And what about the idea that the spike protein itself, the thing the vaccine tells our body to make, was toxic or harmful?
Yeah, that misunderstands the whole point of how mRNA vaccines work.
How so?
They provide instructions for our own cells to produce the spike protein temporarily. This protein then triggers a safe and effective immune response. It's our body's immune system reacting to this harmless protein that creates protection.
So the protein itself isn't the problem.
No, it's the trigger for the solution, not the problem itself causing damage, as those false claims suggested.
The misinformation even went so far as to falsely link COVID-19 vaccines to AIDS, acquired immunodeficiency syndrome.
Yes, a particularly harmful claim, amplified by figures like former Brazilian President Bolsonaro.
How do they even try to justify that?
They misused data from the UK Health Security Agency, twisting statistics to falsely suggest vaccinated people were rapidly developing AIDS.
Which was completely false.
Completely. Thoroughly debunked by looking at the full context of the data, understanding different factors at play, like testing rates and prior infections, just deliberate manipulation.
Tragically, we also saw numerous instances of false claims that vaccines were a direct cause of death. The VAER system in the U.S. was often brought up.
Yes, the Vaccine Adverse Event Reporting System. It was frequently cited, but often in a very misleading way.
How is it misleading? Doesn't it report problems?
It does report problems, but it's a passive reporting system. It reports any health event that occurs after vaccination, regardless of whether the vaccine caused it.
Okay, so anything could be reported.
Exactly. Anti-vaccine groups often cherry-picked reports from V8 years, ignoring that many events were clearly unrelated deaths from pre-existing conditions, accidents, you name it.
So the system itself doesn't prove causation.
Not at all. It's a signal detection system. Comprehensive analyses of V8 years data, done properly, have not supported claims of increased mortality directly caused by the vaccines.
And specific heartbreaking cases were also exploited, weren't they? Like the deaths of that doctor in Florida or the baseball legend Hank Aaron.
Yes. In both of those very sad instances, medical examiners conducted thorough investigations.
And found.
No connection whatsoever to the COVID-19 vaccine. Despite these official findings, anti-vaccine activists just used these tragedies to sow doubt.
And there was that Florida Surgeon General study about heart problems in young men.
Yes, another example. A flawed study lacked transparency, lacked proper scientific methodology, critics said. It just added to the misinformation.
Contrasting with other research.
Sharply contrasting with robust, peer-reviewed research like studies in major journals like JAMA, which consistently found myocarditis after vaccination to be rare, generally mild, and the risks from COVID infection much higher.
And this pattern just repeated globally. Misrepresented data in Taiwan, similar claims elsewhere.
Yes, a depressingly familiar pattern across many countries.
Then you had the more, well, outlandish claims.
Yeah.
Like vaccines containing tracking agents.
Right. The false tweet about the enzyme luciferase being in the Moderna vaccine for tracking.
Luciferase.
It's a real enzyme used in some biomedical research because it produces light, but absolutely zero evidence of it being used as a tracking agent in any COVID-19 vaccine. Pure fiction.
And the whole concept of being able to reverse a vaccine
Right.
or detox from it.
Yeah, these claims, often pushing things like special detox baths or supplements, they have absolutely no scientific basis.
You can't just undo it.
No. Once a vaccine is administered and triggers that complex immune response, there's no known way to simply remove it or undo that process. It's not like taking a pill you can flush out.
Even the basic availability of approved vaccines in the U.S. became a source of confusion and misinformation.
That's right. The distinction between vaccines authorized under emergency use authorization, EUA, and those that later received full FDA approval, that distinction was deliberately blurred. Used to falsely claim that no truly approved vaccine was actually available, like the Pfizer-Comirnaty naming confusion.
And this had real consequences.
Absolutely. This misunderstanding was even cited in legal challenges against vaccine mandates. It's also important to remember liability protection under the PRP Act applied to all authorized or approved COVID-19 vaccines, another point often twisted.
And finally, that rather peculiar claim about vaccines being an operating system.
Ah, yes. That was just a wild misinterpretation of an analogy used on Moderna's website.
An analogy.
They used the term operating system metaphorically, trying to explain how mRNA delivers instructions to cells, not a literal statement that vaccines were software programs installing themselves in us.
Okay. It's important, I think, to also acknowledge that the spread of information or misinformation wasn't solely the domain of individuals or fringe groups. Governments also played a role, didn't they?
That's right, and it's a complex layer. An investigation by Reuters uncovered a covert U.S. Department of Defense disinformation campaign.
Really? What did it do?
It aimed to discredit China's Sinovac vaccine, particularly in the Philippines and other regions, using fake social media accounts and other tactics. Presumably geopolitical reasons, trying to counter China's influence during the pandemic.
But that could backfire.
Exactly. It highlights how even state actors engaging in information tactics can have unintended consequences, potentially damaging overall public trust in vaccines, not just the targeted one.
Okay, let's shift focus slightly now to more socially based misinformation. We saw claims circulating very early on that a vaccine for COVID-19 actually existed before the pandemic really hit.
Yes. These conspiracy theories often pointed to old patents for vaccines against other different types of coronaviruses.
And falsely claimed they were for SARS-CoV-2.
Right. Implying a cover-up or that the pandemic was planned. Fact-checking organizations like PolitiFact, factcheck.org, quickly debunked these. The WHO also confirmed the lack of treatments early on.
There was that awful story about Senegalese children.
Yes, the completely unfounded and cruel story about children dying from a non-existent vaccine trial. It just illustrates the malicious nature of some of this stuff.
The magnetization claim. That was definitely one of the more memorable ones, probably because it was so visual.
Oh, yeah. The idea that the vaccines made people's arms magnetic, metal objects sticking to the injection site.
Spread like wildfire on social media, didn't it?
Dear videos, yeah. Despite being so easily disproven, experts explaining there are no magnetic ingredients, no microchips large enough, and pointing out the simple science of skin oils allowing smooth objects to adhere temporarily. That claim gained significant traction, even promoted by some public figures.
It really shows how visually compelling but factually wrong content can just go viral.
Absolutely.
And then there were those videos supposedly showing disappearing needles during vaccinations. What was that about?
Those videos actually showed the normal function of safety syringes.
Safety syringes.
They're designed so the needle retracts automatically into the barrel right after the injection. It's a safety feature to prevent needle stick injuries.
But the misinformation twisted it.
Deliberately misrepresented this safety feature as proof of a staged or faked vaccination. Look, the needle vanished.
Wow. Political divides and a general distrust in government clearly played a huge role in fueling vaccine hesitancy, too.
A massive role. Anti-vaccine beliefs became tightly intertwined with existing political and ideological movements, like QAnon, for example.
QAnon embraced anti-vax views.
Very much so. Figures like Romana Didulo in Canada actively promoted anti-vaccine narratives, sometimes inciting violence. Anti-government groups, sovereign citizen types, also latched onto anti-vaccine sentiment.
Politicizing a public health issue.
Completely. And you saw how pre-existing social issues could feed into it, like the experiences of Roma communities in Bulgaria during lockdowns.
How so?
They felt unfairly targeted by restrictions, which deepened existing distrust in institutions and likely contributed to vaccine hesitancy within those communities.
And it wasn't just fringe groups, right?
Yeah.
Some mainstream politicians voiced doubts.
Yes, even some right-wing politicians in France, for example, publicly questioned the effectiveness and safety of the vaccines.
And we even saw formal government actions that could be seen as fueling skepticism, like Florida Governor Ron DeSantis calling for that grand jury.
Exactly, calling for a grand jury to investigate vaccine development and promotion while framed as being about accountability.
Yeah.
It was viewed by many in public health as further legitimizing anti-vaccine narratives and potentially undermining public confidence.
Okay, let's delve a bit more specifically into the reasons behind vaccine hesitancy itself. What were some of the key concerns people actually articulated?
Well, concerns about menstrual irregularities were definitely a significant issue, especially early in the rollout.
Was there any truth to that?
It's complicated. A 2023 meta-analysis did suggest a possible association between vaccination and temporary changes in menstrual cycles for some.
Temporary changes.
Yeah, like slightly longer or shorter cycles, maybe heavier bleeding for one cycle. But the analysis also heavily emphasized the need for more rigorous research to figure out if there's a definitive causal link and what the mechanism might be.
So the uncertainty itself fueled hesitancy.
Understandably, yes. For some people, that uncertainty was enough.
Pregnancy also emerged as a major factor influencing vaccine decisions.
Yes, pregnant individuals consistently showed lower vaccination rates compared to non-pregnant people of the same age.
What were the factors there?
Things associated with lower uptake included younger age, lower levels of education, lower socioeconomic status, and also whether they typically got the annual flu shot.
Interesting.
And some research also suggested that experiences with systemic discrimination or medical racism might also contribute to vaccine hesitancy during pregnancy, particularly within certain racial and ethnic groups.
The situation in Hong Kong offers a really insightful case study, doesn't it? Into the complexities of hesitancy.
It really does. In Hong Kong, you had this unique mix of factors leading to initially very low vaccination rates.
Like what?
Well, partly a lower perceived risk of severe illness early on when the virus was relatively contained there. Widespread misinformation, definitely. Significant political distrust in the government following protests. Specific concerns about the different vaccines available, Sinovac versus BioNTech. Even things like packaging issues initially.
Yeah, a lot of things.
And underlying skepticism towards Western medicine played a role for some too.
And the consequence.
Tragically, much lower vaccination rates among older adults. So when the Omicron variant surged, Hong Kong saw significantly higher death rates in unvaccinated seniors compared to vaccinated ones. A stark difference.
The United States also showed its own distinct patterns of hesitancy.
Very distinct. The stark partisan divide in death rates after vaccines became widely available is maybe the most powerful illustration.
Higher death rates among Republicans.
Yes, significantly higher excess mortality among Republican voters compared to Democrats' post-vaccine availability, strongly correlating with vaccine skepticism in those communities.
And other factors in the U.S.
Well, hesitancy varied a lot by region, by demographic group. While rates were generally high among medical professionals, things like overall trust in science were a huge predictor.
Uh-huh.
Ethnicity played a role, with historical experiences of medical racism being a key factor in hesitancy within some Black communities, often citing things like the Tuskegee experiment.
Right, that legacy of mistrust.
Exactly.
Yeah.
Reflected in lower vaccination rates among, say, young Black New Yorkers initially. And you saw similar medical mistrust dynamics in countries with histories of Soviet-style communism, or in Russia itself, where information about their own Sputnik V vaccine might have been limited or viewed with suspicion.
And the environment became quite hostile for proponents.
Extremely. The threats and attacks faced by pro-vaccine scientists like Dr. Peter Hotez just underscore the intensity of anti-vaccine sentiment in some quarters. It's a sobering picture of the real-world consequences.
So, faced with all this misinformation and hesitancy, what did authorities do? Let's talk about the countermeasures used to encourage vaccination. COVID-19 passes were one prominent strategy.
Yes, digital or paper passes. Countries like France, Italy, Slovenia, Greece, Lithuania introduced them.
Restricting access for the unvaccinated.
Right. To restaurants, events, sometimes workplaces. Italy, for example, saw a noticeable jump in first-dose vaccinations right after mandating these health passes for all workers.
Did they work overall?
Mixed results, often controversial, but they did seem to boost uptake in some places, at least initially.
The active encouragement by public figures, celebrities, that was another widely used tactic.
Very visible. Politicians across the globe, presidents, prime ministers, local officials, getting their shots publicly, urging constituents to do the same.
And non-politicians, too.
Oh, yeah. Media personalities like Arnold Schwarzenegger, musicians like Dolly Parton, actors, athletes like Magic Johnson and Kareem Abdul-Jabbar. Specific campaigns targeting communities, like the UK video featuring ethnic minority celebrities. Oprah Winfrey, Whoopi Goldberg, many tried to use their influence.
Hearing personal stories from people who were initially hesitant but changed their minds, or those who regretted not getting vaccinated. That could also be powerful.
Definitely. The accounts of regret from unvaccinated patients in hospitals, sometimes shared by public health officials like Chris Whitty in the UK, and just the varied stories of people directly affected by the virus, losing loved ones, those provided compelling, though often tragic, testimonials. Some people changed their minds, others stuck to their guns even after getting sick.
Some countries took much stricter approaches. Targeted lockdowns just for the unvaccinated. Fines.
Yes, more coercive measures. Austria and Germany announced lockdowns specifically for unvaccinated people, which sparked huge debate and protests. Greece implemented fines for unvaccinated people over 60. Singapore adopted a policy where unvaccinated individuals had to pay for their own COVID-19 medical care if they needed it. Ukraine mandated vaccination for certain professions, putting unvaccinated employees on unpaid leave. These more forceful measures often drew considerable criticism for being discriminatory or infringing on liberty.
Then there were the carrots, not just the sticks. Vaccine lotteries, offering other benefits.
Right, trying incentives. Russia offered cash prizes, even cars. Numerous U.S. states, cities, universities offered scholarships, cash, freebies. Poland had lotteries for cash and cars. Even some private banks offered employee bonuses.
Did the lotteries work well?
The evidence on their effectiveness is pretty mixed. Some studies suggested a small, temporary bump. Others found little impact. Didn't seem to be a game changer overall.
And finally, the most direct approach. Vaccine mandates, implemented across various sectors and institutions.
Yes. France mandated it for healthcare workers, military, firefighters, very early on.
Yeah.
Austria announced a nationwide mandate for all adults, though its implementation faced major hurdles and was later suspended.
And in the U.S.?
A real patchwork. Many private businesses imposed mandates. Schools, universities like Rutgers were early movers. Healthcare providers widely mandated it. President Biden's administration pushed for federal contractor and large employer mandates,
Which faced legal challenge.
big legal challenges ultimately struck down in part by the Supreme Court. But you still had widespread mandates at the state, local, and institutional level. This led to lots of debate about exemptions, religious, medical, and instances of local resistance, protests, even people resigning from jobs over it.
So as we kind of wrap up this deep dive,
Mm-hmm.
wow, we've really navigated a vast and complex landscape here.
Definitely.
Misinformation surrounding COVID-19 vaccines, the many, many reasons behind vaccine hesitancy, and then all those measures taken globally to encourage vaccination, some quite controversial.
Mm-hmm.
It's crystal clear that the misinformation wasn't just random noise. It took on so many forms, skillfully misrepresenting science, twisting data.
And then tapping into existing social and political divisions,
Yeah.
exploiting distrust. Which really brings us to a crucial point for you, the listener, to consider.
Yeah.
Given the sheer volume, the variety, the nature of the misinformation we've just unpacked, what does this whole episode reveal about the fundamental difficulties? The challenges in effectively communicating complex, evolving scientific information in our digital age?
That's a big question.
And maybe more importantly, how can we as a society actually cultivate greater trust, build better understanding, especially when faced with such pervasive and often really compelling false narratives? Something to think about.